when are we meant to be showing our faces? Only when we speak or generally?
Councillor Coleman, it's entirely up to you. It'd be helpful if you can show yourself on camera if you're speaking. But if your bandwidth is a problem, then obviously come off the camera.
It's been a bit funny, but it's sort of up and down today. But we'll see how it goes.
Councillor Richardson, over to you.
Good evening, everyone. Welcome to members of HISPAC, our Health, Inclusion and Social Care Policy and Accountability Committee. Today's virtual meeting. To officers, presenters and observers, I'm Councillor Richardson. I chair this committee. And before I begin, there's a few quick housekeeping notices. Please, I know everyone knows this all by now, but it's good to still have a reminder. Please keep your microphone on mute unless you're speaking. And please wait for the chair to prompt you before you're speaking. And if you'd like to speak, please indicate by raising your hand. So not everyone has, either virtually or physically. We've got officers, external guests from the NHS and observers here this evening. So if invited to speak, please introduce yourself and tell us the organisation you represent. Thank you. And if I could ask people not to use the chat function because not everyone can access this. Okay, so let's move on to the first item, item 1, which is the minutes. To note, members to note 2 sets of PAC minutes held on the 4th of November 2020 and the 27th of January, which was a joint budget meeting with CPAC 2021. Apologies for absence. Item 2, none to date. Do we have any other?
Chair, we do have apologies for lateness from Councillor Quigley.
Okay, yes, no, I got that. Thank you. And item 3, roll call and declarations of interest. I'm going to go through a roll call of committee members, and so if colleagues can please respond, that'd be marvellous. So councillors, we have Councillor Bora Kwan, Vice Chair.
Present.
Councillor Mercy Ume. Oh, we'll come back to her. Councillor Amanda Lloyd Harris.
Yeah, present.
Or you could say hello, just hello.
I couldn't, I'm stressed out.
Well done for getting here, Amanda.
We're here.
I feel your frustration with digitalness. I think we've all had enough of that, of Zoom meetings. Anyway, Victoria Brignall, Co-op T.
Here.
Welcome. Jim Greeley.
Here.
Keith Mallinson.
Here.
Welcome. Roy Margolis.
Yeah.
Hi. And Lucia Boddington, a new appointment.
Yeah.
Excellent. I now invite members of the committee to declare if they have any interests, and if so, which items. Thank you. We won't introduce, is that so we have no interest so far? We won't introduce everyone, but we also have with us Councillor Ben Coleman, Cabinet Member for Health and Social Care. And we're going to be joined by Councillor Patricia Quigley, an Assistant Cabinet Member, and I can also see, we had Councillor Sue Fenimore here, which is lovely. And I'd also like to welcome senior officers from the Council, including Lisa Redfern, Strategic Director of Social Care, Linda Jackson, Director of COVID-19, and our Director of Public Health, Dr. Nicola Lang. So I'd just like to remind, though I don't have to do great lists before each item, if speakers will introduce themselves for their respective items, I think that's much better. So we'll move on to item 4, which is appointment of Co-op T. This is for committee, as you know, Nurse Nightingale had to stand down to agree the co-optation of the appointment of Lucia Boddington as a member of the committee. So I'd like to ask Lucia to introduce herself.
Hello everyone. I'm Lucia Boddington, and I'd like to thank Councillor Richardson for proposing me. By way of introduction, I've lived in Hammersmith and Fulham for about 25 years. I have 2 daughters and they were both educated here. I'm a qualified solicitor, but for the last 10 years I've worked as a non-practicing solicitor. as I have a child who has SEN, and I've been focusing on SEN law. I'm particularly interested in neurodiversity, mental health, and more recently, in inclusive employment. So that's sort of my areas, and I hope they'll be sort of useful for the committee.
Thank you. Thank you very much, Lucia. I'd like to invite members to agree the co-option of Lucia to the committee. See some nods. Excellent. Thank you. I'd also like to welcome Kim Smith, who apparently is on the call as well. Oh, I missed out. Our director. So moving on to item 5.
Good evening.
Sorry, good evening, Kim. Sorry, I can't see everyone on my screen, so I didn't see you there. Item 5, COVID-19 update and COVID vaccine uptake in Hammersmith and Fulham. So I'd like to welcome Linda Jackson and Dr. Nicola Lang.
Thank you, Chair. I thought we'll take you through the current COVID rates, and then Director of COVID will talk through the vaccinations. So our current COVID rate has gone up in the last few days and week. It's now at 44 new cases per 100,000 people. This was from a low of 29 cases per 100,000 people. We have looked at the cases in the last 2 weeks, as we always do, and we've seen that 40% of the new cases are in people under 20. There's a new testing regime in schools, so it is a good thing that we are finding cases in schools, but it's also an absolute need for vigilance and keeping up with infection control measures. In terms of lateral flow testing, that has good uptake with just over 100,000 tests done. And just to inform the board that Local Zero, which is a contact tracing pilot where the council contacts people within hours of being notified of a case, started last Tuesday, the 23rd of March, and 70 people have been contacted by our contact tracing service so far. And I will now hand over to the Director of COVID.
Hi everybody, good evening. So we've had a number of challenges around vaccinations, and some you'll all be aware of. We've had 3 areas, 3 primary care networks have been running since, 1 since December, 2 since January, and then we opened an Overtown mass vaccination site on the 15th as well, which was fantastic. And that's a real joint work with our NHS colleagues and the council. We've had really good uptake at the mass vaccination clinic, and we had a local link which was really easy to use. Unfortunately, not just in Hammersmith and Fulham, some people shared the links on WhatsApp, and then we got people booking in for vaccinations who didn't need it, weren't a priority group. It's really important that we stick to the priority groups. We've got enough vaccine for everybody. So we've done lots of work with people and with communities. It was nice to hear Jim reference before we started about the work we're doing at North West London about vaccine hesitancy and why some people have concerns around vaccinations and uptake. And we've done an awful lot of work on that. You'll see the stats that were sent out with the pack. That's actually a week or so out of date now. We update our data every Wednesday. We meet with our CCG colleagues. I can see Janet on the call every week as well to look at our take up. We did really well with vaccinations. We hit our target of the original target of 75%, 80% of over 80s, over 75s, people in care homes. And then the target has now been extended. It's a stretch target and we should always aim for better. So we now have a target of 92.5%. We've done lots and lots of work with our communities, trying to understand what people's concerns are. And they are concerns and real beliefs. And it's not about necessarily just issues going around on social media. these are people's real fears, and there's some deep-rooted concerns, certainly in our Black African Caribbean community. That's led us to really start to look wider at how we engage with our community. So that's going to be a big piece of work and a lesson learned for us in what our public health offer needs to look like post-COVID. To date, we've done 20 small community group events. In fact, our very own Bathsheba, who's the clerk for tonight, has actually led quite a lot of those, and they have been really successful on a number of counts. Not always about people taking the vaccine, but it's about people talking to each other, about understanding each other and gaining respect and confidence with each other. So that's been really, really good. It has also meant that people have increased the vaccine take-up. However, there's an awful lot more to do. We know there's an awful lot more to do. So we have a vaccination plan. It's a joint plan with our CCG. That talks about how we're going to continue to provide vaccinations throughout 2021. And also, it's really important that our GPs who've been busy giving vaccinations and are indeed giving second vaccinations as we speak, have the ability to get back into business as usual, as well as we come out of COVID and hopefully get into a more recovery as the lockdown gets lifted. So the plan talks about how we're going to manage the vaccine, how we're going to prioritise, how we're going to link with our communities and provide bespoke clinics where that's more appropriate to do that. We've had a lot of success with our people who are at home, who are not able to get out, in giving people vaccinations at home. We're doing a lot of cross-checking now with people who have home care as well, and those who may have 3 or more visits a day, to make sure that they have been offered a vaccination at home. And we're also ringing people, people with direct payment, personal assistance, people who we know have not yet been offered or not indeed taken up. It may well be that they decide not to, which is fine, but we just want to make sure the vulnerable people in our communities are all supported in that. So I think there, Chair, I'm going to stop. The or anything that Nikki said, happy to talk to. Thank you.
Thank you very much for that, and thank you for the report. I just want to add how impressive I've been hearing about the engagement activities, and I think I'm really excited to hear more about the learning that's come from that and what we find, because we are a borough with historically low vaccine take-up, not just for COVID. So I think that's been a really exciting progress to follow. So I'll open now. I know the rest of the committee will have lots of questions, as we always do, about this. But I wanted to just add my commendation for that, because it sounds very exciting, and hopefully something good will come out of that, out of all this work. Thank you. So I can see a hand from Amanda.
Thank you very much. Impressive, which is good. The feedback I'm getting is positive. But I do know, could I ask that in future, given that these figures change quite dramatically week on week, is it possible, since we get other reports quite late, that we actually had the more current one on the take-up? Because one of my questions was about the take-up, which still looked very, very low. And I'm just, I think, Chair, you've actually mentioned that historically the borough is not very good at this, but it still seems, even taking that into account, quite low in comparison to other boroughs. Do you have any sort of thoughts or comments that I may have missed out on as to what can be done? And should I ask, I've got another question with it, so should I ask the two together?
Chair, may I come in on that?
Excuse me, Councillor Coleman,
Forgive me.
could I possibly just finish this? You may be, or Linda Jackson or something may be able to address this. What I was going to ask is that we clearly, according to this set of figures, have people still in our care homes that have chosen, for whatever reason, not to be vaccinated. Now, they're with our most vulnerable people. So I'm just wondering what measures, if any, are in place to encourage people in these areas to actually take up the vaccination? Thank you.
Thank you, Amanda. Yes, so I think, would you like to, Linda, would you like to answer all the questions in one big lump, or do you want to do them piece by question by question?
So I'll start, if I may, by answering the first question about the take-up. Yes, you are right, Councillor Lloyd Harris. We are one of the lower take-up in North West London. I think, and Janet Cree's on the call, she may want to add to this, but I think the other thing is as well that we started probably 3 weeks later than other boroughs as well. Other boroughs started sooner. So there is a time lag, but that's not the excuse for it. You're absolutely right. We weren't very good at flu vaccine take-up, and we've got a lot of lessons to learn from that. I think what we are doing, though, is sustainability. So we are not making massive strides, and we're not, making a 10% improvement week on week, because actually what we are doing is getting underneath the issues that are concerning our communities about vaccination and immunisation take up generally. And because of that, we're taking a learning from that and changing our approaches. And I said earlier about the changes that we'll make around population health management, public health and community engagement. We've learned an awful lot from the people that we're talking to about a lot of assumptions, not just the council, but all statutory services probably make, and trying to understand that. But we are making steady progress on that, and the vaccination plan that we've signed off together is a live document. We're constantly reviewing it. So, yes, we are lower than others at the moment, but there is still room for improvement, and we have a steady plan to improve that. Okay. Janet, I saw you could pop up on video. Did you want to add to that? Sorry.
Yeah. Yes, thank you. I was just going to pick up specifically the point about the care homes. And actually, Hammersmith and Fulham, we've got the highest, though we are lower in some of the other cohorts, we've got the highest uptake with regards to immunisation of our care home residents at 96.2%. So that is the highest in North West London. And I think that is a testament to the work that we have done as partners, but also the work that Nikki and the public health team and the local authority have done within the care homes to make sure that we have got our residents making informed decisions about what they're doing. But otherwise, it was just to really reinforce and add to what Linda has been saying.
Okay, I think that's really helpful, Janet. I appreciate that. And that actually would have been something that would come under in any other report as good news, given that people are concerned about that. But that I couldn't see unless I've misread something. So I appreciate that update. Thank you.
Thank you. Okay, Councillor Coleman, did you want to come in there, or shall I take it?
Appreciate that.
And I've got questions stacking up now.
I can see that. Lots of hands raised. No, that's brilliant. And Amanda, forgive me, I didn't realize you were going to ask a second question, so sorry to interrupt you just then. Okay. If I could just explain something from the perspective of where I'm sitting from as the cabinet member. Vaccination is the NHS's responsibility, not councils. And we are, thank goodness, working incredibly well together, as we have been ever closer in a really productive way since the beginning of COVID. It's been a tremendous boost to the way in which the council and the NHS work together and support each other. And we're able to get involved and support the vaccination drive and all sorts of other things that the NHS is doing much more effectively. What's happened over the past 5 years is that we haven't addressed the issue of flu vaccine effectively. I raised this in the Health and Wellbeing Board last autumn. We've had the worst the borough has had. And I remember the NHS, forgive me for fingering anybody, but the NHS is responsible for flu vaccination. We love to support them. And they've been the lowest figures for 5 years in London. So there has been a problem there. And we raised this in the Health and Wellbeing Board in autumn, and we said the coronavirus vaccine is coming down the track, and we need to do lots of research to understand why people don't want to take the flu vaccine, because there'll be issues about taking coronavirus vaccine. There'll also be new issues about that. So this is something which has concerned us for quite a while. And where Linda is being very professional about putting things is The real shock, I think, for any of us in hoping that everybody wants to get vaccinated is the large number of people who don't want to be vaccinated. And the largest number of people, and I've talked to some people here about this, Councillor Ume and I have had conversations and others, there is a large number in the borough of people from, I'd say, mostly black and ethnic minority background, Caribbean in the main, African background as well, who have told us that they have no faith in the system. I can understand that people not having faith, not trusting the government. I can understand people not trusting their local council. What's really shocked me is when people don't trust the National Health Service. And what's come out of this pandemic, it's not just here. I mean, there's a very good piece in today's Financial Times. There's one of many pieces all over being written more and more about this, is there is a massive gap between our expectation of how people see the NHS and how so many of our fellow citizens actually see the NHS. And we talk about things like tackling inequalities and other language, which, if I can be honest with you among friends, skirts around the issue. The issue is that people feel that they've been treated less well over decades because of their colour. And they don't trust an NHS which doesn't provide interpreters when they go in, and their children have to go with their Somali mothers to talk about intimate problems because there isn't proper interpretation services there. There are all sorts of issues. Kim Smith, our chief executive, I hope you don't mind me repeating the story you told me, but you met a nurse, black nurse, as you were leaving something the other day, and she said she wasn't going to get a vaccine because she told you there were 3 vaccines and they were going to give the worst to black people because that's what happens. Now, this is all we can all say, oh, this is all so silly, and some of the problems which have been raised, and we'll talk about some of the issues raised, you know, oh, they don't make sense. They don't make sense to us because we do not get how so many people in our society see our behaviour. And as a liberal white man, I have been truly shocked, and I'm actually very upset by the fact that so many people in this country who may be of a different colour do not have confidence in the National Health Service. So when we're talking about getting people vaccinated, that's fine. That's brilliant. We want everyone to be vaccinated because it will be good for everyone. But we can't only want everyone to get vaccinated to protect the white people. And once everyone's vaccinated, I'm putting this in a very strong way because
I think that's a very important point.
We're talking about perceptions here, and I think we have to really confront them because the issue goes much further, much deeper than vaccination. It goes about issues which go back over decades, or in some cases over hundreds of years, 400 years, back to the kings of slavery. But it's really problematic what's come out, and it's an incredible opportunity now for us to understand the challenge that vaccine reluctance presents us with in terms of the perceptions of our society by so many people who don't feel treated equally. And what we in this borough, and we always like to start from this borough and spread the good things elsewhere, what we in this borough need to do now, not just to get people vaccinated, but to get into communities to understand them so that they feel that the health service, along with other services, housing services and all the others, treat them equally. So this is a huge public health challenge, and it's not just about vaccination. Forgive me for taking so long, but I
agree. It's a very important point. But I was just going to say that I think it's something we should definitely bring back to the committee and look in more detail all the findings of the learning from this, because that's when we can make the difference. So I look forward to working with your drive and passion, Councillor Coleman, and the other people who've been doing the engagement events to find out more, and maybe we could as a committee look at some watch some of these or forward some of the links to them if they've been on YouTube. I think that might be interesting for us as a next piece of work, but I think that's really important. So thank you very much for highlighting that issue to us. I have now a list of people. I have Jim, Victoria, Roy, Keith, Bora and Lucia. I don't know, Linda and Nikki, how you want to take how you want to take these all as one. Shall we let everyone ask their questions and then respond, or would you like to do it person by person?
If it's okay with you, Chair, can we do it person by person? Yeah. Then we make sure we don't miss anything.
Okay, great, thank you. So we'll start with Jim.
Thank you, Chair. First of all, very heartening to hear Nikki and Linda talking about change and progress, and that really must make people in the borough feel much, much safer. But we are starting from a low base, but moving forward. Two questions, each one is short. I know a very large percentage of those over 70s and over 80s have been vaccinated, but there's a supposed national shortage which will lower momentum for those who are waiting for their first jab. How will the borough keep up expectations so that people just don't give up when they won't have their first jab for another month because of a national shortage? And the second is a more technical one. We're hearing stories, detailed ones, following through, that some people who don't have digital technology are not being contacted, or who do not have digital skills are finding it very hard to make bookings. And given that poverty, age, and a variety, and linguistic variety in the borough, there are factors to be taken into account. These seem to me to be technical problems which you may have thought about, but I'd be curious to know what you've got to say.
Thanks, Jim. Two really, really important points. The first one, just to reassure everybody that whilst there might be a national shortage for a short period of time, we have in fact had this conversation on several occasions with our CCG colleagues, and we can confirm there will be enough vaccination coming into the borough, is actually in the borough, to do first vaccinations of the JVCI priority groups 1 to 9, so that is 50 and above, those with long-term conditions and those who are carers. There is enough vaccination, and there is also enough vaccination for those who are now in receipt of their second vaccine, are ready for that as well. Your second point, Jim, about how we enable people who don't have the technology. Actually, the GP surgeries have been actually contacting people directly, and have been offering to make appointments directly for people. The second thing is we've got the council's CAN network, that's our community aid network, where we have our contact centre staff are also following up those contacts. And if somebody doesn't have access to a computer or a smartphone, that we will actually book those appointments for people. We've also been advertising the contact centre widely as well. We've been putting it out on social media, so people can give us a ring and we can do it on their behalf if that is a problem for them.
Could I just come back for a tiny second? I do know accurately that this afternoon at Parsons Green, one of our supporters, accompanied by a very responsible adult, was told, and she's in the age group, because she turned up for her first vaccine, having been sent by her GP, that they were not doing first vaccines. And that was this afternoon. And the conversation I've had was quite detailed by somebody who does not exaggerate or get things wrong. So I'm just wondering whether there's variance between these centres.
Okay, I'm sure Janet wants to come in and respond to that.
Well, I can take the details of that. I can just to reinforce what Linda was saying. We have sufficient supplies for all of the JCVI groups within and over the next few weeks. That is absolutely the case. So I don't know exactly what the scheduling for Parsons Green is today or this week. It may have just been a confusion about that, but I'm more than happy to follow that up, Jim, if you want to email me the details.
Thank you, Jim, for raising it, actually, because I was going to mention my husband's been having problems getting his second vaccination at Parsons Green. So maybe that's something worth looking. They just aren't giving out appointments. So
again, it will be about timing of when the vaccines arrive. So it will all be scheduled. And as I say, it's not about a lack of vaccine availability, but there is it is quite a complex scheduling process. So please be reassured that people will be called.
It seems to be the appointment scheduling rather than the vaccine. There just aren't the there just don't seem to be appointments where you can actually book. He keeps clicking. He's got an invitation to book, but you can't book it. They're all full. So anyway, it will be useful to look at that further. Thank you. Victoria. Jim, does that answer your question? Victoria.
Yeah, thank you, Lucy. Thank you, Chair. Yes, I've got a question about the information we were sent. I was concerned that the data we were sent about vaccine take-up didn't seem to include figures for care workers. I think it's really important we know what the take-up rate is for care workers and care homes, for care agencies, and for care workers directly employed by disabled people. And this is an issue that I care about because I employ a team of 8 carers, or PAs as I call them, and half of my PAs are refusing to have the vaccine. So it's an issue that I think that I feel quite strongly about. And then there's the 2 things I want to say in relation to this. I think it would be really good if the council or the NHS put together a pack of resources to send to people like myself who employ PAs, which we could use to try and persuade our PAs to have the vaccine. A pack of videos or articles or leaflets that we could use to try and persuade our PAs the benefits of having the vaccine. Secondly, I think that one of the issues here, the underlying issues, is that obviously care workers are often younger rather than older, and I think that there's a basic assumption among them that it won't happen to them, that they won't get the virus, and if they do, it won't be very serious. And I think that we may have to think radically about this. I think if we're going to get more people amongst care workers to take the vaccine up, we seriously think about giving people a strong incentive to do so. And I would encourage the council to try and come up with incentives that would motivate people to say yes to it, and maybe even be radical and offer a higher pay rate to care workers who receive the vaccine. Because I think that it needs to look like that, say very simple, very direct, to entice people to have the vaccine. I think lots of the arguments that we use at the moment are just not landing home. If people felt in their pay packets, I think that could well encourage people to take it up.
Thank you, Victoria. That's very interesting.
Chair, can I come in and answer that question, please, if that's okay?
Yeah.
Hi, thank you, Chair. Thank you, Victoria. All very good questions. If I can make a start. So I'm really keen to talk to you some more, Victoria, on what you've just said about different incentives. Ideas that we've already introduced are offering carers, paying for an extra day off, and offering to pay carers for the time in lieu, if they go and get a vaccine. So that's one of the ideas amongst doing tailored sessions that we've been doing. But I'm sure myself, Linda, Nikki and I will be very happy to talk to you to look at other ideas that you've got, because they sound grand, and we're always willing to think about anything, anything that's going to make a difference. Secondly, in terms of take up, I'm happy to say that in terms of staff in care homes, we've significantly increased the take up of staff in care homes. So we're looking at, I think, 80+% at its best in care homes, where it's taken quite a lot to get to that point, and it's taken a lot of different approaches. It's taken, first of all, support for the providers in the care homes, tailored sessions, which Nikki and others have been involved in, other members of staff. Then also me writing fairly robust letters to the care home providers about proper leadership around this, that it's critical. It's no point residents getting a jab and then care home staff not. So I think we're in a much better position, and we're certainly I think over 2/3 way down the battle. I think in most cases it's 80+% now. In terms of the support workers going into people's homes, at the last count, and this was stats I picked up earlier today, I think we're something like 61%. So still a way to go, but better than we were a week ago. I think, as Linda alluded to earlier, it's been a bit slower generally. I think now getting the next kind of layer of take up really. So again, we need to constantly be looking at what we need to do. I hope that answers your question, Victoria.
Yeah, sure.
And thank you.
Certainly, if a bit higher pay rate isn't feasible, maybe a one-off bonus for people who do have a vaccine.
I think a one-off bonus. I'm not sure about a higher pay rate on a permanent basis, but certainly a one-off bonus, and that's what we've been looking at. So yeah, sounds good. Yeah.
Thank you, Lisa, and thank you for raising that, Victoria. Roy, you had a question.
Come off mute. Thank you, Chair, and thank you for the update, Nikki and Linda. I've had my vaccine, and you're doing a fantastic job with the vaccination rollout. I just wanted to ask a bit more detail about some of the points that Amanda made. In the chart in the report, Hammersmith and Fulham had the second lowest proportion of vaccinations on JCVI groups 1 to 4. And Janet just said we've got 96.2% of care homes have been vaccinated, people in care homes, which is excellent. But that probably means that that's a lower proportion than of older and clinically vulnerable people in those groups. So I just wanted to ask, is this due to the issues that Ben was talking about, the minorities and the mistrust of the NHS generally, or are there any other factors there?
So from the engagement work that we've done so far, some of it is about race and how people mistrust the communities. There is quite a lot of mistrust of the NHS, as Councillor Coleman referred to. So we've done an awful lot of work actually with Nikki, and we have a year 2 junior doctor that is placed with us at the moment, just talking to people about the vaccine, where it comes from, what the implications are or the side effects. Some people are generally just thought, actually, it feels a bit too quick to have come up with a vaccine. And actually, we've seen a good take up of people once their colleagues have been vaccinated. They've then come back and said, oh, okay, it's fine. I can see they're okay. So I think there is a lack of a mixture of mistrust, but also just a lack of understanding of that. I think the third thing, which is quite interesting, which I think Victoria alluded to as well, that actually what we've also getting now is some residents who are rightly saying, I want to make sure anybody who's giving me care and support has a vaccine. So there's a lot of pressure, and you'll see in the media that a lot of the big national care institutions and domiciliary care providers are now actually making some big bold statements about how they will ensure that new staff are vaccinated and won't be recruited without that. So there is also the pressure also that's coming from the employment market about more people getting vaccinated. I think we've got to see it in the context of healthcare, that healthcare workers have been vaccinated for a number of years, and it's been a requirement of their PIN, which again, Nikki can talk you a bit more about, but there has been a requirement that you do get there's a routine vaccinations for a number of underlying diseases. So I think we've got to bring it, the requirements based on social care in line or in similar line to those in the NHS as well. Nikki, I don't know if you want to touch on that any or leave it at that.
I think that's beautifully described. It's just about making it part of the culture in social care, the same way that we ask people to wear PPE is the way that we explain it to our small groups. It's just a normal thing that you do to go to work. But we really need people to get vaccinated, as Victoria Brignall outlined, is important.
Thank you.
Thank you.
Thank you. So I've got 3 more questions now from Keith, Lucia and Bora.
Hello, can you hear me?
Yes, can hear you, Keith.
Okay, yes, I'm going to first of all talk from the chalk face because I'm volunteering and I've done every session at White City Community Centre. The uptake has been very good. We've had I would say, a 50-50 BA, AME, and if you like, the sort of white population. Everybody's been very good about it. We've told everybody to talk to their friends that they've had the vaccine. The whole team there, from the doctors, the nurses, and the volunteers, are doing a fantastic job. We work flat out from start to finish, and I think, I'd like that to be recorded. Secondly, my one question I've got is, what are we doing to address vaccinations for the homeless?
Okay. Do you want me to take that?
Yeah, sorry, Janet. Yeah.
Sorry. So yes, we have had a concerted effort to use our outreach teams and roving teams to support our vaccination of our homeless population. Again, what we've tried to focus on is teams and staff that they are familiar with, because that tends to increase the uptake and provide the reassurance and information that's required in order for them to make a informed decision. So yes, we've both our asylum seeker and our homeless populations, we've been vaccinating since the beginning of February.
Thank you, Janet, and thank you, Keith, for that work, the valuable work that you're doing. It really is admirable. Has anyone else got anything to add on to that to answer? Shall we move on to the next question? Okay, shaking head. So Lucia, would you like to ask your question?
Yes, hi. Just a continuation about carers being vaccinated. It's not necessarily a question, it's more a point that whilst paid carers are being vaccinated, a number of unpaid carers are really struggling to be vaccinated, despite having children within tier 6. I equally had this issue with my child, and I had to draw my vaccine centre to footnote 3 in the government website, which refers to paid and unpaid carers. So I just wanted to see if that could be just fed back to the vaccine centres, to say if people are struggling to be vaccinated.
Sure, I'm sure Janet wants to come in here, but as part of the phase of JVC 1 to 9, unpaid carers are part of that catchment group now. They weren't previously, so I totally acknowledge that, Lucia. Whether they should have been is a different conversation, but they are now. I think we're trying as hard as we can to reach out to as many carers as possible. We've also put actually the mass vaccination site a lot of information and posters, because a lot of people don't see themselves as carers, but they are. So we're trying to build up that knowledge of who is a carer in the borough, working with our carers network and also with our GPs, and also trying to get a message out to people that say, you are a carer. It doesn't mean because you're not paid that you're not a carer. So definitely they are. And I'm sure Councillor Coleman and Lisa would say carers is a big priority for us over the next couple of years as well. Janet, do you want to add anything about carers vaccinations?
No, I think you've probably said it all. It's just to reinforce it, exactly what you've said, and absolutely they are in the cohort, and our vaccination centres and our GPs should all be aware of that and enacting that.
Thank you, Lucia, for raising that, and thank you for the answers. So I've got 2 more questions now from Bora and Councillor Ume. I am aware this is interesting, vitally important stuff. We have got our community champions waiting for us for the next item. So could we, if we have those two questions, and then Councillor Coleman, maybe if you round up at the end, or was it something you wanted to add now? So Bora.
Yes, I've got a suggestion regarding the outreach to ethnic minority, to address ethnic minority vaccine hesitancy, because I've actually been involved quite sort of last minute and unofficially in some work that has been happening in, not in our borough, but in my parents' borough, which is Kingston, because there is a Korean community there, ethnic minorities, and the specific problem there was misinformation about the AstraZeneca vaccine, not helped by obviously all the international politicking going on, but unfortunately there was a lot of misinformation about, you know, the good vaccine versus the bad one, and someone actually contacted me to say, could I sort of say something or speak to people, which I was slightly reluctant to do because I'm not a medical professional, but then I have contacts who are Korean British doctors, including a GP who actually is working currently and has been for the past year at the Soho walk-in clinic, so is on really the sort of coalface, the front line of addressing it. And what we realised, and through her contacts, we were also able to find nurses and other health professionals, and we found that the voices of the sort of the sons and daughters, if you like, of the sort of second generation of immigrants who now work for the NHS, have become doctors and nurses, are very much more respected than sort of celebrities, politicians, etc. And we hosted a sort of informal Zoom session where people were asking questions, and you know, I had people contacted me afterwards, said, you know, they'd booked, they were going to talk about to their friends about how the AstraZeneca, you know, vaccine wasn't the bad vaccine, etc., etc. But it occurs to me that I think that sort of people who actually work within the NHS, I mean, a lot of the sort of pandemic has been about appreciating our key workers, and I think their expertise, I think, probably holds a lot more weight, especially in those communities where there's possibly communication issues. I've been an interpreter at in the NHS for sort of Korean people who've had that mistrust and language issues with doctors, and quite often it's overcome when you've got people who are trusted, and it's just sometimes seeing someone of your community actually working within the NHS who can say, actually, no, there isn't a queue for good vaccines and bad vaccines. It's not that, you know, this is being treated. So I'm wondering whether something informal could be or something formal could be set up, maybe speaking to NHS sort of health professionals who come from ethnic minorities, and also particularly ones who are from the community. Maybe, you know, they've trained in London, or, you know, they have those networks, because I think their recommendations and advice carry so much more weight than a random sort of public official who people don't know personally.
Thank you.
Thank you. That's really helpful. Can I, sorry, Chair, for just say that is the model that we've been using, and it is proving really, really successful. But I think not just with NHS people, but also community faith leaders as well, are people who are trusted. So it'd be great to hear your experience. So if we can touch base outside of this, it'd be great to pick up a conversation with you about what your experience has been. Thank you.
Yeah, I was just going to jump in there, Linda, because I've been hearing from Bathsheba about some of the events that she was organising. I wondered if she wanted to say a few words about how they organise the makeup of that. Thank you.
Hi, Councillor Richardson, thank you. Just picking up on the point that Councillor Quan's made, it's absolutely right. The clinicians that we're using are broadly representative. A lot of them are actually second generation immigrants as well. So it's absolutely right that we've been able to support some of these events with people who are able to understand, empathise, and obviously respond in an appropriate way. It's absolutely the cornerstone of some of the events that we've been running.
Thank you. Thank you, that's excellent. So we've just got time now for Mercy.
Thank you, Chair. And I just want to say thank you to Bathsheba and Councillor Coleman for what they've done, tremendous work among the ethnic minority groups, going to churches, as you said, and so many people have come back to me telling me how it has been good and has made them to take their vaccines. So I'm really grateful for that. And on our side, just out of interest, how many percentage of BM group in our borough took the vaccine? That's the only thing I just wanted to ask. And going forward, I'm glad that this thing, as Councillor Coleman said, and as you mentioned, Chair, that this program has to come back, because we need to find a way for a lesson learned from this and how to take it further for future programs. So thank you.
Thank you for that, Mercy. Do you want to comment on that, or shall we move on?
Just quickly say, I don't have the latest figures. The figures I had, Mercy, was when there was, among those who were reluctant, there was 18%, 20% were Caribbean origin, 18% were African origin, and it gets much less of people from Asian origin. White British is less again. But the actual figures, Linda, you may be able to provide those latest ones. I'd also like to say I didn't have the pleasure of going to a church. The last person that anybody from any of the reluctant communities wants to hear from is a counsellor. It's been people themselves who Bathsheba and with Mercy's, with Councillor Ume's great help, and Bathsheba and Linda have been organising these events where people from the community speak to people from the community, and that's the only way. Because if you have, as you have, years of mistrust, which has grown as a result of your experiences in this country as one of the citizens of the country, but nonetheless never treated quite equally, you need people you can trust to talk to you. And that's the lesson that we have to take forward, learning that we have to go right into the communities, understand what the situation is there. It's not just about vaccines, it's about all sorts of things, all sorts of levels of health and people's health and the way they feel supported or don't feel. That's the big challenge for us. And I know we're going to be talking about inequality later. In all its aspects, not just the inequality caused by racism, but that is something that we have to pursue. And we're now very fortunate in that the CCG and the Council are working very, very well together. We are co-chairing the primary care network, the ICP, which is the local coming together of all the healthcare providers and systems. And we need to put this is already, we know, going to be a big issue for them to address. Can I just say one tiny positive thing, which is not to do with this particular issue, but I just want to congratulate again, if I may, and you'd be pleased. Linda mentioned right at the beginning that we've been asked to be involved in a pilot of something called Local Zero. And if you forgive me, I just want to explain what that is. That is, we've been saying for months now that the money that the government is spending, billions that the government has spent on national test and trace, has by and large, and it's not us that's been saying, it's by and large been very, very poor return on capital, shall we say, and that local authorities should be given the job of doing all the tracing where they can. And we've been picking up the many 20 to 40% of people that the government hasn't been able to contact. It's not NHS test and trace, it's national test and trace, government test and trace, not the NHS. But we've now been given, Lambeth and Lewisham, I think, Linda, you can correct me, are part of a 3-borough pilot called Local Zero, where we are now given the job not just of picking up the people who the national system has failed to trace, but also going there, tracing people from the beginning. And we're able to do welfare checks, we're able to talk about money, we're able to talk about all sorts of other things, which makes it a much more wraparound support than people were getting initially. And the big aim is to identify people who've got COVID, identify the people they know who've got it, and get them to self-isolate. And that is it's much more likely to work, from our experience if the local council is doing that with local people and local support, than someone calling in from a central line put in there by one of these very highly paid management consultancies who've made so many billions out of the crisis. So I'm very pleased, and I think we should be very proud that what Linda's been doing on test and trace with Nikki and all our officers has led to us becoming one of these 3 councils which is spearheading it in London. I just wanted to end on a happy note there.
Yeah, thank you very much for that. It's always good to be kept in touch with what's going on, and congratulate. Yeah, that's very exciting news. So I'd like to invite members to note and comment on the report. I'd like to bear in mind that we'd like an update for all members on the numbers, the vaccination numbers, and also we would like to be kept in the fed information about the engagement events and the learning from that, which I'm sure Councillor Coleman can do that for us, and the way we're going to take action on that. So with members' permission, I'm going to vary the order of the agenda from put item 7 as item 6, the next item, with this community champions, because we're very lucky to have one of the community champions who've been doing invaluable work with the vaccination engagement as well. And they've written us a report which sets out the council's work with the community champions and the depth of community experience to promote testing and vaccination alongside their regular public health messaging. So I'd like to welcome again, we've got Dr. Nicola Lang, Director of Public Health, Joanne McCormick, who's the Assistant Director for Social Care and Public Health Commissioning, and Chide Ogunro, who's the Community Champions Project Manager for Old Oak Community and Children's Centre Peabody. Chide, I'm so sorry to have kept you waiting. Thank you so much for attending the meeting, and welcome everyone. I don't know how, Nikki, I don't know how you want to organise it. Who wants to speak first?
I'm happy to start, Chair. So just to sort of set the context for Community Champions, it's a commissioned service. The Community Champions work in pockets of deprivation in the borough. There are 6 community projects and 1 maternity project. And the champions work to improve health and well-being in the borough. When COVID happened, they rapidly shifted their activities to online, doing welfare checks on people, delivering food, and ensuring that public health messages were shared amongst their networks. And as you say, Jide Ogunro will share his experience and learning from the work at Old Oak. Thank you.
Good evening, everybody. Thank you for having me as well. It's been, I think, initially in terms of migrating our services online, because, for example, in Old Oak, it's a it's the only community center locally, and there's not much going on within the area. It's really deprived. And in terms of the community center itself, it's the focal point of a lot of activities that run locally. So I think that was the initial challenge in terms of migrating even all the services online, but we have done that successfully. But specifically concerning to the COVID rollout, we've been running workshops, I would say fortnightly, and we promote them locally. And we have a very robust text messaging service, which we text out to all our local residents. And we have community champions who are really embedded within the community and are trusted as well. And so they help us as well through word of mouth and through their own local communities. And also inviting clinicians who reflect the local community has really, really been helpful, because people have felt more comfortable. And we've really been looking at in terms of making sure we don't really have huge group sizes when we have these sessions, just small groups of, I would say 6 to 8 maximum. And so there's a lot of flexibility in terms of people asking questions, and they feel comfortable and relaxed in terms of being able to ask questions and get responses that are satisfactory as well. So, but I think because also the Champions Project in Old Oak it's been there for a couple of years, and it's trusted. People have responded to our outreach in terms of at this period in time, and we've had a gradual uptake in terms of people, and a reduction in hesitancy in terms of locally for people to actually go into work more closely with the NHS in terms of getting their vaccines. I think because we have a very good reputation locally in terms of good relationships within Old Oak, it really does help in terms of even promotion, like you want to have a workshop and they trust that you're going to bring somebody reliable, somebody that they know will be able to respond to their different concerns. So we've not been able to, in terms of recruits, as you can imagine, more champions, but we've been able to hold on to the champions we had before the pandemic started, which is really good as well, because it's been a challenge in terms of people actually, holding on to the volunteers they've had. But we've been able to hold on to maternity and community champions throughout this period, and they've really, really helped. Some of them have actually led on our sessions as well, in terms of, so that gives them, that kind of confidence as well, to speak to people locally. So I'm open if you have any questions that you want to ask in terms of our Champions Project.
Thank you. I'd just like to thank you on behalf of the committee, because I know how much personal commitment and passion you must put into this project to keep it going, because it is all down to people like you and sharing with the community. And I'm a great fan of this scheme to help people to help themselves. And I can tell by the way you talk about it how much personal investment, passion you have in the project. So I'll open to members' questions. I have a couple if we don't have. Oh, you've got your hand up. Sorry, I couldn't see it.
Keith has his hand up.
And Keith, yes, okay.
Thank you.
Yes, thanks very much. I really welcome this approach. Now, there's one thing which I'm concerned about. I work for Shepherd's Bush Family Project. Now, I'm also a member of the Advice Forum. And as you know, there are so many different support agencies in the borough, and we're all working together. Now, one thing which came up yesterday, which really struck me as in many ways we're working in silos. And I'm just wondering whether you've got any ideas how we can work together more. We were looking at a particular family. And it seemed in this case conference that each agency was doing their own thing, but we were not linking up. Now, what I'm interested in is having like a seamless service, a sort of a holistic service where there isn't going to be that duplication. And how do you see your role in that?
Thank you very much. I think it's because of the initial design of the Community Champions project, because it's targeted on different wards, and each ward has their own project manager. So there's always been, in a sense, that kind of approach where each individual project manager would focus on his local or her work on their local wards. However, during this pandemic, we've, as project managers, tried to work closer together in terms of not duplicating activities. Like if, for example, if we have a session, it's open to everybody locally. We cross, for example, Ala, who is the Hammersmith and Fulham CCG coordinator, he sends us all the promotion activities, and we run them simultaneously at the same time. So we try as much as possible not to duplicate. I agree there's still some duplication, but we're trying to reduce that in terms of just trying to ensure that we just have one activity running and ensuring that we're not cross-referring, and we can really kind of coordinate the different workshops we're running together. But it's been a bit of a challenge, I must admit. And I think it just boils down to the way the projects were set up initially. So some kind of legacy issues there. But I would say that we have cooperated more during this time of the pandemic as well. And for example, I've opened up all our workshops to anybody in Hammersmith and Fulham can attend. We promoted it widely, and the project managers are able to refer people to us. But I agree there's more work to be done in terms of ensuring that we're not duplicating our mess. But we do have regular meetings of project managers, and something that I'll definitely take up with the project managers at our next meeting next week for sure, to ensure that we kind of ensure that we're not duplicating these different services. So because I think it can be a bit confusing.
Yes, I think that's an interesting point to have raised, Keith, because the Community Champions project is very local, isn't it, in its nature, very focused on the particular areas.
Yes, exactly. Yeah.
So it's interesting. So who did we have next? We had Amanda. Amanda, you're on mute. And Jim, is that a hand, Jim, or a scratch? Amanda, you're on mute.
Yeah, I know. I've clicked it 4 times so far. We are now back. Sorry, someone had to do it, I guess.
You loud and clear, yes.
That's unfortunate.
You get the award for this meeting.
For incompetence. I just want to say thank you very much for that report. That was really, really interesting. That sounds patronising. It's not meant that way. I was just wondering, could you tell us specifically, because of Old Oak, how does one evaluate the success of the projects that you will be running?
What we use is we use definitely in terms of attendance at different activities, the amount of promotional activity we do, but more in terms of number of attendees. We always have feedback at the end of each session. For example, if I'm going to run a specific workshop, I have a database of about 3,000 residents on each on our books, which I send out all the time. We also have we leaflet the estates all the time. We have about 900 residents we leaflet to all anytime we have activities. So it's more we get feedback in terms of from our champions as well, number of residents that speak and get back to our champions as well. Also in terms of the number of attendees that we have at different workshops we run and how much we promote.
Okay, thank you very much. Chair, is it possible to request that in a year's time or whatever it might be, that we actually get an update on all of these projects just to sort of gauge how they're going? And I assume that's probably going to happen as we go along, but it'd be nice to have that at some stage, please.
I think that's a very good idea. And what I was going to suggest when COVID is all over and we don't have to worry about meeting together, if we could, as a committee, members might be invited to come along to some of the events. Committee events would be lovely, because I've been to a few in Edward Woods, and they really are fantastic. But it's a nice way of getting to know the area. So certainly, Amanda.
Thank you very much.
If we don't have any more questions, I've got a question, which is, I think, more about commissioning. It's what I wanted to know, but it would be interesting to have the insight as well. I wondered, the maternity champions looks like it's really taken off and has been an excellent idea. I wondered if there was any plan to go further with the mental health champions, disability champions, and also young people community champions.
Would you like, I can answer that one. Sorry, my camera is not coming on at the moment. Apologies, Councillor. It's Jo McCormick speaking here.
We'll believe it to you, your name.
So we are at the moment just renewing the arrangements we have with all of the projects, and we had completed some evaluation of projects just before COVID and have done some further co-production and evaluation just started in the last couple of months, and that can inform what we seek from these commissioned services in the future. And so yes, there's scope to incorporate the wider range of champions in that mix.
Thank you. Yes, and if we make a note, Bathsheba, to update the committee on that. So have I got any more questions on this one? Otherwise, we can move on to our next item. I'm not missing anything out. Thank you. So I'd like to take this opportunity to thank all the officers for preparing the report and for coming to talk about the excellent project. So the recommendation that we are updated on this, and we continue to work with the community champions as a successful method of supporting communicating with residents in their communities to promote health and well-being.
Thank you.
Item number 7, which was 6, Hammersmith and Fulham Council's draft equalities plans for 2021 to 2025. The report alerts members to the recently launched draft equality plan, currently open to public consultation for a 12-week period until the end of April. So I'd like to welcome Lisa Redfern, our Director of Social Care.
Okay. Thank you, Chair. Good evening, members. So how apt that we're discussing this tonight, and it's given that's been the theme, I think, or very much the theme around vaccination take up, community champions, and so on. So so I think it's great that we're discussing this. As Councillor Richardson said, this report is to alert members to the recently launched draft equalities plan 2021 to 25. Which is open to public consultation for a 12-week period until the end of April. And I'll assume that members have actually read the report, so I'll just go through a few key points. And I know Kim Smith, our Chief Exec, and our Deputy Leader, Councillor Sue Fenimore, are here as well to support this item. The recommendation is that committee is asked to note and comment on the draft Equalities Plan, which will reframe and set the borough direction for progressing equality of opportunity over the next 4 years. Equalities and diversity and inclusion is at the heart of what Hammersmith and Fulham is about, both as a place and a council. Our vision is to become the most inclusive borough in the country, where residents feel valued, welcome and included, embracing the diversity of backgrounds, experiences and perspectives. And again, given this evening's discussion, I think that's a fantastic vision to have and something that can help us and guide us and we can work with. The pandemic we've talked about this evening in 2020, the pandemic has highlighted inequalities more than at any other time. And so the importance of this agenda. The Equalities Plan will provide a focus and a framework for inclusion activities over the next 4 years. And members should note that equalities work is well embedded in all departments, with equalities implications detailed in every policy and expenditure report as a key part of the decision-making process. I think that's all I'm going to say at this point, Chair, and open up for questions and comments. And I don't know, Councillor Fenimore or Kim, if you want to add to the introduction at all. Thank you.
Thank you, Lisa. Councillor Fenimore or
Yes, hello. Good evening, everyone. Thank you for allowing me to say a few words on this incredibly important piece of work that has been going on for some time now. And I don't think Lisa could have put it better, when equalities matters more now than it ever has in the past, whether it be well-being or whether it be health, etc. So I really welcome the opportunity to share this with you, but also ask you to comment on it where possible, please. It would be really helpful for us to have all your views for the committee on what the aspects of the Equalities Plan. But I hope that everybody will be able to spend some time looking at our values and our mission. And as Lisa says, it is our ambition to be the most inclusive borough. And we continue with that vision very much at the forefront of our minds. Thank you.
Thank you. Kim, did you want to add?
Yes, Chair. If I may, my name is Kim Smith. I don't usually come to this committee. I'm the Chief Executive here at Hammersmith and Fulham. Just want to say a few more warm words about the importance not just of tackling inequalities and putting inclusion at the top of the agenda, but just as Lisa Redfern has said, what's really important is that we're trying to understand what not convinced communities think. We often talk about hard to reach communities. I like to think about not convinced communities, whether it's about vaccination hesitancy, whether it's about take up for flu jabs, whether it's about the way in which we as councils, we as public sector choose to provide services. There are people who are very vocal and very able to articulate their needs. And I think that at times the way that we choose to listen is the right time now to challenge how we do things. As the Black woman Chief Executive in Hammersmith and Fulham, I'm very, very clear that there are now 3 other Chief Executives in London. There are 33 authorities, and the point in time when I was appointed, there were no other in London. It's really important that I role model the behaviour around equalities, and it's really important that people understand that we, when we speak about we as an authority and we talk about them and us, that we need to be very careful, because the we actually is a very rich and diverse workforce and very active workforce that represents a wide spectrum of racial groups and have a lot to say about the services that we currently provide. So I think that it's important that this consultation is a 12-week consultation. We're not rushing anybody to have their say. There's a survey that underpins it. But as I say, in terms of the warm words and the actions that underpin this, it's really important that everybody feels that they have a chance to have their say. Thank you.
Thank you very much for that, Kim. I have questions from Councillor Caleb Blandy, Keith, Victoria and Jim.
And Lord
Councillor Caleb Blandy, do you want to start, because you haven't spoken?
Fantastic. Sorry, can everyone hear me? I've got very poor internet.
We can. I can.
Good.
Now,
Good. Fantastic.
though, rather disappointingly.
I'm sure that's a benefit for many. So I think this was a very powerful, really interesting and really well conceived and thought through piece of work. Thank you so much, everyone, for your time in doing this. The question I had was just around, as I think so many of us are aware, that central to this is bringing people up, but there are often some of those marginalised groups can be forgotten, particularly in these types of documents. And I was just wondering about the view about people with a learning disability or with hidden disabilities, such as mental health, such as learning disability, and just what actions what this was really saying for those groups who might not be name checked as thoroughly through the report, and if you could kind of give a description of how we think this could actually impact their daily lives.
If I will make a start, Councillor, fantastic questions and comments. I think first of all, in terms of people with learning disabilities, and people with mental health issues. So we had the Disability Commission, and that gave some recommendations, and we're working on delivering those recommendations. We have a heavy group which Councillor Quigley co-chairs as well, called the Commission Implementation Group, and I think we're taking very seriously the recommendations from that. I think it's about showing that, and we'll take your comments on if their views aren't taken or they're not included as explicitly, because that's something very much we'd want to include in this, given the inequalities that exist in those groups. So just to summarise, I would say we have our Disability Commission report, which has a series of recommendations which covers all aspects of disabilities, including mental health and people with learning disabilities. We've got a Commission Implementation Group, and certainly I think we need to check and look through the lens of this report to make sure it's taking on all of those views and concerns as well, and indeed making sure that we're consulting with those groups. We're taking this report out to consult them on it as well. I hope that answers your question in part.
Thank you.
It does, very helpfully.
And
thank you.
Thank you, Jonathan, for raising that. I'd just like to add, I would like to see, it would be interesting to see the statistics on disability employment included in the pie charts we've got. I think we've got a pie chart about gender equality, gender employment within the council. I know that we have a vision to be the most disability friendly employer. I can see Amanda and Victoria, Keith and Lucia.
Thank you. It's an excellent report, so congratulations on that, and I think there's clearly work to be done on it moving forward. I was just wondering, with these in the background section, would it not have been more appropriate to have waited for the information to come back from the census, or do you feel that we have sufficient current information in the borough to produce this report?
Can I answer? Start on an answer on that one, Councillor Richardson?
Yes, do.
I think it's a really important question, Councillor Lloyd Harris, because on the one hand, there are lots of residents and staff who are impatient for change and think that we are not doing enough. And I think that there's lots of data that we will find either from the census or from ongoing pieces of work. I think that our accountability starts in service provision. We're currently providing services, and we currently know lots of data about our resident cohorts well enough to be able to set the objectives that we have in this plan. And this is a work in progress. Lisa's answer on the previous question says that this is a starting point for us, and we will continue to build on it. But I think, particularly in light of disproportionate impact around COVID, Black Lives Matters, and other campaigns that have been very, very current in 2020, I think it would be remiss of us not to be explicit in starting a conversation, and that's what this report does. It starts to bring equality to the fore. It starts to talk about issues in the way that I heard Councillor Coleman talking earlier about the things that communities are talking about. And I think that we will continue to build on it rather than wait until the point at which we think that we have all of the information.
Okay, I accept that. The other part is and this is, I don't know how I'm going to phrase this without it sounding really not particularly wonderful. We talk about inequalities, but we've mentioned the hideous and tragic death of George Floyd in the States, which is very current and appalling. What we don't seem to have noted is the tragic death of Sarah Everard and the feelings within communities. It doesn't matter where you are in the borough, of women and young girls are feeling that they're being ignored. Now, it's not an easy topic. Obviously, none of this is an easy topic. But I'm just wondering, is there any sort of sense that that is going to be taken into account as well?
The tragic death of sorry, Councillor Richardson. Shall I start a response?
You start, and then Lisa.
Yeah, sorry, Lisa, to cut across you. If
No, don't mind.
I was going to say the tragic death of Sarah Everard is one of many unnecessary deaths around violence against women, and I think we've been vocal in separate strategies on that. I think that, as I said on the earlier question, we will keep updating this work in light of events. What this is trying very hard to do is not capture all of the detail around every group that is discriminated against or where there is some inequality. It is not trying to be a Noah's Ark of all of the communities and all of the groups. What I think it's trying to do is to talk in general terms about what are we going to do to improve our service provision, and our offer to residents. So I hope that it's not going to be a roll call of which groups are included and which ones aren't. I think that it's really important that we reflect on the issues that were most topical in the year before we developed this document. And I think that COVID and the disproportionate impact of COVID has been one of the key reasons why race is very much set out there. But we've also talked about the disproportionate impact around gangs and about the causes of gangs and about community safety. So I think that this is a consultation document. Once we've heard, this is a draft document, once we've heard the feedback and encouraging everybody to respond, the next iteration of the document will again try to respond to what the current issues are. And I think you're absolutely right that violence against women and girls will continue to be one of the big themes going forward in the coming year. If I hand over to Lisa, and Councillor Fenimore may wish to comment on that too.
Thank you.
Not a lot to add, Kim. Thank you. Just to say, Councillor, very much echo what Kim said. We have a community safety partnership which Councillor Fenimore chairs in the borough, and which covers violence against women and girls, and also the Safeguarding Adults Board, which Councillor Quigley represents adults on as well, also covers very much covers this, and it is just to say it is a focus. Can never be enough of a focus, but certainly it's a strong feature of those two boards. So thank you.
Thank you very much.
Thank you for that, Lisa and Kim. So now I have Jim, Keith, and Lucia.
Two kinds of comments. I've lived in the borough for almost half a century, and this is one of the most forward-looking papers I've ever seen coming from the council, and I really do welcome that. A comment I'd make on that is that I hope we continue to be following Councillor Ben Coleman's point about racism earlier on, and I've no doubt about that, the truth of that, that we continue to emphasise that we're a welcoming borough, and the term ethnic minorities must not become defensive. And I say that myself as an Irish immigrant who's part of the community. We must be straightforwardly bullish that we welcome people from elsewhere. And there have been troubling statements across government in recent times where I'm very glad to say we cut against the quick on that one. A second comment though, I worked in education for decades in the borough, and looking at the plan, it occurred to me that one strengthening perhaps, and I put forward as a suggestion, might be the look of perhaps an education board to be part of it. I worked in secondary education, I'm very glad to say, in a very good local school. And I know what education can do, particularly for the socially less well placed, to put it like that, to open up all kinds of opportunity. But also, if handled badly, education can create barriers. It can stratify people being set aside, but it can also give, and the paper is good on this, second chances to those who've lost first time. And I'm wondering whether a forum where perhaps some head teachers, representative head teachers with the councillors and with people from social services should meet on an occasional basis to look at how education itself can feed into what I would hope would be a move forward in terms of actual lived qualities within the borough.
Thank you, Jim. That sounds like an excellent idea. Did anyone want to respond to this?
May I, Councillor Richardson?
Sure. Yes.
So the consultation is to absolutely hear as many of the views and ideas from people. I think that residents will give us a really rich idea. Councillor Fenimore leads on this area and will certainly, as she has done up until this point, be very vocal about direction. And I think an Equalities board is another way in which you can continue a conversation. The listening part of this is really important, and making sure no one gets left behind. So there are not the right words that everybody needs to say, it's the right interest that everybody needs to have. And our Unity Day is a really good example of that, how we're trying to bring people together. So as an officer, Lisa and I will take that away, and at some point Councillor Fenimore will steer this work forward on how we can make sure that the best ideas and options are the ones that we're going to use over the next 5-year plan.
Thank you. And thank you, Jim, for that contribution. It's really interesting to hear all the feedback from the different members of the committee. Keith, you wanted to say something. You're still on mute.
Sorry, can you hear me?
Yeah, we can hear you now.
Okay, 2 points. First of all, I'm going to say I think a big thank you to Sue Fenimore, because I'm sure this is largely her baby. And I know when I worked for Mind, she was so helpful, and that answers one of Councillor Caleb's comments on mental health. And I think we also have a brilliant associate director in Joe Beatty, who is doing some fantastic work at the moment. But one point I do want to make, and that's on the LGBT community. Being an LGBT man myself, a few health watchers ago, we had a brilliant presentation from an LGBT group, Opening Doors, which was for older LGBT people. Now, one thing which came out of that, and because I joined up and I've noticed on their website, is amongst the elderly BAME community who are still afraid of the stigma and some of the insults they get from within the BMA community. Now, I'm so glad that we got a BAME chief executive, and I'd just like to hear from a how she feels we could tackle this very real problem. Thank you.
Thank you for raising that, Keith. Kim, you're on mute.
Oh, yes, I am on mute. It's a really important question, and I'm asked that, and I'm also asked questions about intersectionality quite a lot. I think that there's three things that we should do, and it's really important. First of all, it's about role modelling. This is a standout council, inclusion at its core. We need to make sure that in our policies, in our approaches, in our workforces, that we train people and train our staff, and we understand the relevance of the issues and the services we're providing. That's why language is important, and that's why I talk about the not convinced communities rather than the hard to help or the hard to reach. We also need to make sure that secondly, in what we're trying to achieve, that we're building trust. And we heard a lot about that with the vaccination hesitancy conversation earlier on, that people don't always have to say the right thing. People can understand and explore and understand whether it's about unconscious bias or about their own belief. And we need to challenge that to make sure that people who work for the council and people who work with the council fully understand the reasons why it's important to address inequality, injustice, and discrimination. I think in particular communities, and particularly in the Black, Asian, minority, ethnic community, I tend not to use the word term BAME, because that's just such a catch-all. There are communities, plural, and some of those communities have got a lot of work to do to build trust and a sense of belonging around some of the topical issues. And so the way to do that around whatever the issues are, LGBTQ ones or other ones around gender and about race, I think, is to keep those conversations going. And if you look at the work that Dr. Nikki Lang has done in communities to talk about vaccination hesitancy, she told me last week she was attending an event organised by the Catholic Church with nearly 100 odd people there, talking about vaccination hesitancy and what that means in communities that have taken years to build distrust around service provision and how people could better understand the relevance to them and their communities. And I think that that's what we've got to do with all of the protected characteristics. I think that we need to stop the them and us in conversations and try and work with communities to help them to explore that these issues are as relevant to the Black, Asian, minority, ethnic community as it is to any other. Lisa, I don't know, I'm just going to hand over to you really in terms of our provision in adults, if there's anything more you want to say, and if not, then I'd pass on to anybody else. But I don't want to be the only person who's answering these questions, because I know that there's a number of staff who are on these calls, and it's important to a number of us. Or Councillor Fenimore, actually, apologies, Lisa, if Councillor Fenimore may wish to speak as well.
Thank you, Chair. Is that okay if I go?
Yes,
no?
That's fine.
Keith, very kind of you to say those nice words about me. I do lead on it, but I have to say in some regards it's one of the most joyous pieces of work, because it has been an absolute partnership. And the reason why it is a partnership, because it's about the culture of any organisation and embedding that right across the council. And I think that's what we have done. I can't thank the staff enough for all their commitment and passion to the wide variety of topics that they are now leading on. And it really is an extraordinary opportunity for us to be able to really listen hard to what residents are saying. And I think that's the point. It's really important that we listen at this point. And I take your point, Amanda, and lovely to see you, about the dreadful murder of that beautiful young woman. However, but I don't, and I think Kim picked this up, I don't want to be putting people in particular boxes. What we're talking about is an entirely open, inclusive borough that cares deeply and passionately about people's differences and the things that bring them together. There's absolutely at the heart of this document a workforce and members, administration members, who are absolutely driving this through. It is more important now than ever that we do everything we can to prevent any form of hate. And we have a coordinator in our community safety team who is dedicated to supporting residents who've been the victims of hate crime. And as we go forward, I want to see more of those types of opportunities coming forward with the council. We do have very good links with the name of the organisation, Keith, that I can't remember, but I do remember the guy who runs it, a guy called Richard, who's absolutely fantastic. We've had lots of conversations recently with him. We did an amazing event that staff ran in relation to LGBTQ history month, and I'm really proud of the work that staff have done, and we did that together as well. It's very much a partnership. I think what we're saying here is this is where we are, but where we want to be as absolutely inclusive as we ever possibly can be, and wherever and whenever we see any form of hate, whether it be racism, whether it be LGBTQ hate, that we tackle it and make absolutely certain that that Hammersmith and Fulham, we will not tolerate it here. And I think that's where this conversation starts. We've done a huge amount of work, and I'm really, really pleased with the amount of work. Certainly Kim Smith has been absolutely driving this alongside me as well. But actually the conversation starts now, and I think there's an opportunity where you can really try and do much, much more than ever we have been able to do before, to ensure that every resident in this borough feels included in every aspect of everything that the council does.
Thank you, Councillor Fenimore. It's just wonderful to hear the passion and conviction of all the officers and councillors who are talking about this. Lisa, did you want to say anything?
No, nothing else to add. Thank you,
Carry
Chair.
on with the questions, because I think
Thank
I really want every member of the committee to be able to make their points. So I've got Councillor Quigley, Lucia and Merrill. Is that everyone? Should we start with Councillor Quigley?
Yep. Thanks. Hi everybody. Thanks, Lucy. Before I actually arrived at this meeting a little bit late because I was at a previous meeting, the vaccine huddle, which I think it's been going on for 10 weeks, and I have to say, my eyes have been really, really opened in the last few months, and I've been very upset about what I been hearing, which is probably very strange coming from a white disabled woman. But hearing people, I'm hearing about, especially the BAME community, I'm sorry Kim, I'm using the old term, about the BAME community having real fear of getting the vaccine, having real fear. It's one here maybe to be, cautious about something the government is doing, whatever side, whether it's Labour or Tory, but being in fear of getting something from the NHS. These are the people the doctors and the nurses that look after us, that often save our lives and make us better. So I have been sometimes when I come off these meetings, I'm literally in tears. But in 2021, we are still talking about racism. And I think, metaphorically speaking, we've literally got to drag it out. We've got to drag it out. We've got to kick it out. We've got to build people's trust up. And we've got to ask people, we just cannot put up with this much longer, because it's destroying communities. It is actually destroying families, because you've got one member going for the vaccine, another member not, and it's tearing communities apart. Also, what I want to say is, when I was elected in 2018, I just literally finished being on the Disabled People Commission. And one of the things I used to say, two things I used to say was, if they put a man on the moon, we can do this. And I don't believe in boxes. So I think the way to move forward is we forget about boxes. We forget about ticking anything. We've just got to move forward with this, and we've got to take everybody's idea. And finally, Tim, I would just personally like to say thank you so much to you and the rest of your team for managing. I don't know how you've done it over the last year of doing as much as you could to protect the residents in Hammersmith and Fulham, and that's including me because I've been one of the shielding. So yes, I might go on about disabled people, and I might go on about residents that are shielding, and I don't intend to give it up because I have that voice. So I would say to anybody, if you are part of a community, please use your voice, use your platform, because you are in a very unique position to do it. And I'm going to shut up now.
Thank you very much, Councillor Quigley, for that. I think that's really important points to make. Shall we, Meryl, you had your hand up. Did anyone want to say anything in reply to that, or it was just a really comprehensive and moving speech, Patricia?
Hard act to follow.
Yeah.
but like Patricia, I was also in the other meeting, and I also, of course, am here because I have a partisan interest. So one of the things I wanted to just throw in, and I too am very impressed with the paper and with the work that the authority is doing on equalities, and that includes on health inequalities. But I just want to mention specifically health inequalities as something that does need to be taken up, and taken up at the moment very seriously. If COVID has done anything, it's thrown up the major issues around health inequalities. It's often talked about in terms of the different communities, but what isn't talked about and needs to be brought into the discussion are the health inequalities that also relate to poverty, and is something that it's never one of the protected characteristics. And of course, it intersects, poverty intersects with those protected characteristics, but I would hope the borough not only looks at the protected characteristics, but also looks at poverty as a core factor in health inequality. I think one of the other things that COVID has thrown up very, very strongly is the importance of the local and of local knowledge. And right at the time that this has really come home to communities, what we have is the NHS reorganising the NHS so that the management of the NHS is moving away from local communities. So we've got the merger of the CCGs and have a single CCG where the management of the NHS is going to be much more distant. I think the borough, in terms of equalities and dealing with inequalities, needs to focus, and it's wonderful that Lisa is actually co-chair of the ICP, but a lot of work needs to be done with the ICP and with local PCNs, primary care networks, but making sure that that principle that the borough has of nothing about us without us, make sure that, and Ben doesn't like me using the term patient, so I'll say that local residents are very much involved in developing that work at that local level so that we can counter what will be a move away from the importance of the local in developing equality in health provision.
I think that's an excellent point, Meryl, and I think we're lucky to have your and Jim granular knowledge about how the health service and how that all works. Again, I don't know if anyone wants to comment on that, but
Lisa,
yeah, Chair, can I respond? Meryl, brilliant brilliant points as ever, and on the button, I would say. In terms of the integrated care partnership, this health inequalities definitely is one of the core priorities, as we talked about, I think last week or the week before, whenever we were discussing it. And we've got a lot of work to do. I think that it's a long haul, and we've got a lot of concentrated work, but we've also got we've got a lot of work to do. I think equally, in terms of our public health strategic plan that we're drafting, health inequalities is core. So the integrated care plan, the integrated care board, and our own local authority public health plan, which we'll draft, which we are drafting at the moment with key partners as well, has to ensure that health inequalities is key. And I think it's often said, but it's a much harder thing, not that I need to tell you or anyone of this board, it's a much harder thing to actually fully take forward and implement. And like I said, I think we've got a long way to go.
Thank you, Lisa. And now I've got Lucia, then Victoria, then Roy.
Right, back, sorry. I think my point that I was going to mention about mental health and disability has already been mentioned by Councillor Katie Landy and Councillor Richardson. Just one small point on the pie charts, talking of gender, and Keith's point about LGBTQ. There's nothing about no gender. So it's male and female, but no gender. And I would have thought within the community of Hammersmith and Fulham working population, that should be something that's included.
Thank you.
May I?
Yeah, you.
Yeah, just so we were conscious of that, and we were conscious of putting in pie charts when we didn't have full and up-to-date data. Comes back to Councillor Lloyd Harris's point. This is the draft plan, and we'll take that feedback and make sure that the final plan has got more up-to-date data. We're running a big campaign at the moment in the workforce. Just over 2,000 people work for Hammersmith and Fulham Council, and we're running a Share Not Declare campaign to try and get people to tell us more about their data. It's a trust building exercise because people don't want to always tick the boxes. I think we've got more work to do, but I'm very keen and to make sure that as much as is possible that we try to show the pie charts or the data that's representative of all of the communities. And I think that we're relying on data that's incomplete, but it's work in progress. And I really do take the feedback. By the time of the final plan, I hope that we've got a lot more accurate data.
Thank you, Kim. Victoria.
Thank you, Chair. As Chair of Action on Disability, I obviously care deeply about the equality of disabled people in particular. In addition to this Equalities plan, I'd also like to congratulate the Council with the independent living vision they are in the process of drawing up. Disabled people have a right to choice and control of their lives, and an independent living vision is crucial to achieving that. I know that the Council's co-production leads Tara Floods and Kevin Caulfield are playing a key role in drawing up the vision. I'd like to take this chance to thank them for tremendous work they're doing on this.
Thank you for that, Victoria. Lisa, are you the right person to answer that one?
Yeah, I think again, thank you, Victoria. The independent living vision work we're taking forward, leading in social care, but we're actually taking that will be taken forward across the council. Obviously, social care, not that I need to tell you, are a key in this. And so changing, having that vision first of all, then leading, embedding, and training staff on it as well is also crucial if we're going to change the way that we actually deliver plan and deliver support for disabled people and how they live in the borough.
Yes, thank you for bringing that to our attention, Victoria. I think maybe that's something we could put on the work plan when we come to that, to review that, the work that's been done on that. I've got Roy now.
Thank you, Chair. And just to echo everyone's comments about this is an excellent report and the consultation document too. I've just got a quick question about Objective 5, which is the council becoming an employer of choice and fostering greater inclusion. Should that also be promoting greater inclusion in private companies in the borough? For example, helping companies support people with disabilities and mental health issues?
Thank you, Lisa. Who wants to?
You go, Lisa.
No, I just think another good point that we'll take forward. I think that's incredibly important to include. Thank you.
And if I could add, for Hammersmith and Fulham, it's as much about place as it is for us being one of the largest employers. So in our place, there are some other key employers, large and small. Their practices are as important to us. And I think that if you look right across the whole, the raft of equalities work, you're starting at modern day slavery, and that's an issue that's pertinent to small and large businesses, and going right through to how to make your workforce more inclusive. So we have an industrial strategy that works well with a number of partnership agencies, businesses, and others like Imperial. And it would be really important that Hammersmith and Fulham is a place where not just the council, but all of the employers, schools, and other partners agencies start to understand that, as I said, from London Living Wage to modern day slavery, that the equalities agenda is something that's relevant to all of us.
Thank you. Thank you for that. I know Councillor Coleman, you wanted to say something. I could see your hand as well, Amanda. What I think we need to decide as a committee is how we want to respond, whether we want to do a joint response from the notes from the minutes, we could ask Bathsheba to forward, or whether members want to respond individually. So that's something to think about. And decide, which we could do either at the end of this meeting, or we could do via email. Councillor Coleman, did you want to feedback?
I'm very happy to come in after all the committee's questions have been asked.
Oh, okay. Amanda,
it's a very quick one.
Wary of time, yes, but
yes, very quick one. Was just mentioned about sharing and declaring information by council staff. What exactly are we expecting from that, and what does it would it include? And is there the possibility that could be some pressure put on people who feel that they don't wish to share and declare, and how would that be addressed?
If I may answer that one, it's a quick question and a quick answer. We've got a workforce in excess of 2,000 people, and we compile data on ethnicity, on gender, on various, on disability. We are better able to serve the workforce and respond if we've got accurate data. At the moment, we ask people to complete forms at induction and throughout their employment. If we try and phrase it, this is the importance of language around a share, not declare. You're not making a declaration that just goes somewhere and you don't know what happens to your data, which is where some families and some communities have felt that the census questions quite intrusive. This is not a declaration. This is about sharing your data in order for us to better serve and better respond. And so there's no, it's not, staff aren't being mandated. There's a group of staff who've done a video and talked about the benefits of how we could better deliver services and better respond. So really take your point. I think it's at the heart of building trust Councillor Lloyd Harris, and our numbers have gone up around ethnicity in the last year because more staff now want us to understand the representation across the workforce, so that we're better able to talk about succession planning, about role modelling, and about being an inclusive employer. So I think data is at the heart of that, and encouraging people to have a culture where people feel able to share their data. I think, as I say, will just fundamentally help us to deliver better services.
Thank you. Thank you very much for that. Councillor Coleman.
Yeah, thank you very much. Thank you all very much indeed for all your comments, and your having obviously read the paper, which is always brilliant, and the insightful comments you've made, the good questions you've asked. I come to this as somebody who's been following with great interest what Sue Fenimore and Kim Smith and everybody else have been doing, and coming in from the point of view of my particular area of responsibility, which was health and social care. But a couple of points I'd like to make, and we've talked about women and disability, we've talked about Black and Asian minority ethnic, and we talked about LGBT. The big point coming out of all of this is what we're trying to do as a council, and we say this phrase, we're trying to do things with people, not to them. And it sounds, people often don't understand what that means, but it should be what we all do as a society. I mean, the only way you can do things with people and not to them is if you listen to what they're saying. It's if you co-produce, is another phrase that's often used. If you listen to them. I mean, the awful thing about, one of the many, many awful things about the murder of Sarah Everard is the fact that most men have no idea that most women are followed most of the time, a lot of the time. And I only know this because when I was 16, a friend of mine said she was sick of being followed home from the tube. And I said, what do you mean? She said, oh, well, all women are followed. And I said, not serious. And I asked all the women I knew, and they all said, yes, we're followed. And I could see women in this room responding to that. Men don't realise this. They don't realise that if they're walking behind a woman and they're on the woman on her own late at night, that you should cross the road, not freak her out, and 1,001 other things. My niece walking down the road the other day got wolf whistled by a couple of builders the day after Sarah Everard's death, and she just told us, I cannot believe what you're doing. How dare you do this, particularly now? And they got really, really narky with her. So men have a massive, massive, massive responsibility to understand how women think, and they can only be done by listening to them and asking questions. And we all, men and women, have a huge responsibility, particularly white people, to understand what people who are from a different coloured skin are feeling at the moment and generally feel, because we haven't done that sufficiently well. On disability, we also need to understand what people disabled want, not what we're prepared to give them, what they want, and how we can make everybody's lives equal and ordinary. And LGBT, the same thing. Everyone thinks the battle there is won, but Keith has absolutely rightly raised the issue of particular issue of older LGBT men and women. And I'm delighted we could fund Opening Doors to reach out to those. And I'm delighted we have such wonderful people working for the Hammersmith and Fulham Community Action Network, AID Network. We saw a guy got in touch with us recently, and he'd lost a partner, and the way he was talking, they felt that he might be gay, and somebody who's gay called him up and had a chat to him, was able to offer him extra support with his isolation. This is a guy in his 80s, than otherwise would have been the case. And these are officers doing amazing things because they're thinking in an amazing way. And we want all officers and us trying to do it. And all of us, we're all learning all the time. I mean, I had to learn about women being followed, and there's 1,001 things I'm learning all the time, and I've learned so much since being a counsellor. But and Kim talked about intersectionality, which again sounds like a jargon phrase to somebody, but it means just because you're a woman, you're not racist. Just because you're racist doesn't mean you're black, doesn't mean you're not sexist. Just because you're white, you're not all these things as well. We all have to try and work on all these different things all the time, and it's difficult. But that's what this is about, this piece of work that we're trying to do. In the public health arena, which is mentioned a few times tonight, our new public health strategy, which we're developing on the back of what we've learned over the past year and all the work that's been done on inequality in this plan here, is we'll be looking at particular issues around race and around poverty, and part of that will intersect with food, which intersects with isolation. There are lots and lots of things that we have to do. We've been challenging violence against women and girls a long time. It's mentioned in this report, but none of these things should be seen. You talk about women, or you talk about black and ethnic minority people. What about women? You talk about women, well, what about gay people? None of these things are either or. It's all part of a whole. That's what we're trying to do with this. I'm delighted by the conversation we've had this evening. I think it's been really, these things aren't discussed enough and openly enough, and I really appreciate the way that you've done that this evening. And please do send us in individual comments, encourage people to look at this paper, and let us have thoughts, because I know that Sue and Kim and everyone are determined to make this the most extraordinary piece of work for a really, I have the honour of saying, a remarkable council, but that's because of the people I get to be with. But thanks very much, Chair.
Thank you. Yes, and thank you again for officers and councillors for this report. It does make me very proud and moved to feel part of this administration, and indeed to chair this committee, where the wealth of knowledge and experience and the diversity has really come out this evening. I'd like to extend a particular thanks to our Chief Executive and Deputy Leader for coming and providing us with such astute and interesting comments. It's been a great discussion. So I feel very proud of this council. I feel very proud of this committee. And it's an exciting document. I think what we'll do is we will collate the comments and send them around, and encourage people to make individual comments as well. So if we move on now to the work programme, just to note, sorry, this is no, item 8. And then item 9, the dates of future meetings are 21st of July 2021, 10th of November 2021, and 26th of January 2022. So I'd like to thank everyone for coming tonight and contributing so fully. Jim, are you waving your hand?
Could I suggest an addition to the work programme? I'd love to do so because there's so much work. But the CCG in our borough met for the last time formally 3 weeks ago. And we learned yesterday that the ICS, which begins on the 1st of April, is going to meet 4 times per year for North West London for 2.5 million people. Anybody who's worked in a big institution, I did in education, knows that when things change, if you centralize power and you actually do not institutionalize intermediary bodies, power settles with those up there. We've learned, the council's learned through COVID, we've all learned local works. So I'd like to suggest that as a standing item, we invite the ICP, the PCN and the residual CCG, because we need to have an influence by asking questions on those who actually make decisions about us locally. And being told we're doing very well from people in Melbourne is quite welcome, but really, if you actually don't have a way of holding people to account, you actually gradually lose all influence you've got. And it's their decisions, not ours.
Thank you. Thank you very much for raising that. I think we should definitely note that. Thank you. So with that, if there's no more questions and comments, I'd like to declare the meeting now over. Thank you very much, everyone, for attending. And again, thank you very much for all your excellent, outstanding contributions. Good evening.
Chair.
Thank you.